My name's David Cates. I'm the Executive Director of Missoula Medical Aid, a nonprofit that has worked in Honduras for 22 years. It's supported by people across this state. Because of the changing situation in Honduras right now, the virus and the inability of families to earn a living, that tens of thousands, if not millions of Hondurans are going to be facing acute hunger in the next few months. We have relationships with particular communities and with particular partners that can help us funnel donations from here to there in what we think are very efficient ways. We've always been told by the Hondurans we work with how to help in the best way, and so we've done projects that have helped rural people build small businesses, help rural people grow vegetables or different kinds of food that they could then market. We've helped fund a dental clinic and an eye clinic in a place where these kind of services are not available unless you have money. We sent orthopedic surgeons to do work in an area where there are no orthopedic surgeons. So somebody falls down, they break their arm, they grow up with a crooked arm. And these were messages we got from Hondurans. Because things are changing so fast now, the situation on the ground is very dynamic. The situation up here is very dynamic. Between now and the end of the year, we're trying to really focus on raising money here and getting it down there into the places it needs to be.
My name is Doris Martinez, and I am the Honduran Operations Manager for Missoula Medical Aid. Right now, I want to briefly share with you who we are, what we've been doing, and what we're doing right now to aid those most in need here in my country, Honduras. Hopefully, you can help us achieve that goal. Right now, due to COVID, we're faced with a new situation. A country that was already broken and in extreme poverty has been hit even harder, and it's been harder for them to reach their basic need of food. And that's what we're doing right now. We're trying to provide food security to these families that are most in need. In the food bags, we try to include a well-balanced diet. We've also helped purchase cleaning supplies because cleaning and cleanliness is so important right now with this current situation of COVID. Another thing that we're doing to help with food security is providing farmers with seeds and fertilizers for them to further their crops, help their community, and create more food security in their area. We don't want a country that's already in hunger to go even more hungry. Please help us achieve that goal. Thank you.
I was fortunate enough to be asked by David Cates if I would be interested in joining a trip to Missoula Medical Aid in Honduras, and I said yes and joined up many years ago and have since gone to Honduras about 15 times. The very first time I went, there were about 200 patients standing outside waiting to see me, which was quite overwhelming. I've been fortunate to see those patients over and over and taken care of several of them on multiple occasions. And that has been a real joy to watch them be able to recuperate and regain their livelihoods. I remember one woman particularly, her name's Maria, and she came to me a number of years ago with burn contractures in both hands with multiple fingers contracted down, and we agreed to take care of one of her hands, and we took care of it and told her that we didn't know how she would turn out, but to please come back and see us. The next year she came back, gave me a huge hug, showed me her hand, and couldn't wait to get on the schedule to do her other hand. In all these years, I've had so much support from our community, our donors and supporters that has allowed me to provide this care. Thank you all so much, and I would love it if you would continue to support our organization.
We will do our very best to spend in a way that helps people in Honduras who need it.